I think as we're seeing clinicians who are utilizing tools like this, that we actually see more individualized notes because they better reflect the content of the session and for that particular individual, for that client, for that patient. If you have ever been someone who's had to train new clinicians on how to write a good progress note, you see a lot of templates and a lot of supportive tools that help folks to learn, and a lot of processes where I can think back to what that looked like for me. I read a lot of other people's notes. I had a lot of tools and templates that I was asked to use for a period of time, and lots of folks, my supervisor read my notes for a period of time. And so I think if you kind of consider the current process around what that looks like, and even kind of fast forwarding to once you've been in the industry for a while, note taking is, like you said, it's nobody's favorite part of the job, but it's an important piece of the job because we want to be sure that we have the documentation to be able to coordinate care appropriately for that individual. And so I actually have not found that to be a concern once we've gotten started. So we're really looking forward to having more person-centered documentation and really seeing that reflected in the record, the more we're able to incorporate these tools.
I think it's important to remember that when people express that concern, which is a legitimate concern, one of the things you're comparing it to is people copying and pasting notes from the last session, or worse, from a different client with a similar problem. So, that's a pretty low bar. And this technology is so different, in my opinion, that it's hard to remember that if you have the same client come in the next day with exactly the same presentation, you're going to get an entirely different set of recommendations for the note because it's individualized to that intervention. So, I think like you, Ashley, that these actually produce better notes. And a side benefit is that clinicians who have trouble kind of coming up with creative ways to say things, what we found is that they start seeing examples of how to write a certain part of note, and they start learning. It's like learning by example. You start seeing examples of how you can say something differently different times, and that's kind of an added benefit.
It's a better note problem than we have right now. We already have repetitive notes that aren't cut and paste. Part of them are repetitive because many of us build our own templates to help us do certain parts, especially the mental status exam. And all of us have certain stock phrases that we apply repeatedly in most patients. I can't tell you how many mental status I've read where it's oriented to person, place, and time, and everybody's calm. Their mood is always calm. I can't believe everybody when I said, "Well, how you feeling today?" He said, "Oh, I'm calm. I'm calm." We're fearing something we're there already. So, why are we fearing something's going to happen that's happening right now? I think this is a chance to have a better problem.